Hello everyone, I'm Anastasia signing in from Nora's. In today's session, we will be dealing regarding the various methods which we can follow in order to facilitate bowel elimination. As we know that bowel elimination is a natural process by which the soil materials or the soil products after defecation will be eliminated from the bowel. Here, if there is any alteration in this process, then we can also adopt to various methods in order to facilitate the bowel elimination. Here, the first method is by passing a flatus tube. The second is through enema. The third is by administering a suppository. The fourth is by performing bowel wash. The fifth is through the digital evacuation of the impacted fecus. And the last one is by the care of patient with ostomies. So these are the various methods which we can administer or which we can follow in order to help the patient facilitate the bowel elimination. So in order to get a clear idea of how each and every method works, let us discuss about it in detail. So the first method is by passing a flatus tube. Here, this flatus tube, also known as the stoma tube, is a medical treatment in which a device can be passed through the abdominal wall into the stomach. The main purpose of performing this procedure is to decrease flatulence. Here, if a person is having flatulence, then it is very common that they will be having an abdominal distension. So in order to prevent this distension from occurring, in order to prevent the severe abdominal distension, this procedure can be performed, as well as this procedure can be done before giving a retention edema. As we will be discussing about enema in detail, there we will get an idea that there are different types of enema which can be administered to the patient depending on their condition. So here, if retained enema is to be administered, then usually before this procedure is performed, it is necessary that we first pass the flatus tube. So before we perform this procedure, we must make sure that we place the patient in a left lateral position. We must also lubricate the flatus tube about 15 centimeter. And once this is lubricated, we must separate the anus and we must insert 12 to 15 centimeter of the tube into the rectum, and we must tape the tube. We must then connect the free end of the tube to the extra tubing by using a glass connector, and then we must also make sure that we place this in a basin containing the antiseptic solution. So here, as a nurse, we must make sure that one end of the tube is being inserted into the rectum and the other end must be placed in a basin containing the antiseptic solution, because it is only through this manner we will be getting an idea whether the passage of flatus is taking place or not. Here, when the flatus is passed, the solution, which is the antiseptic solution, will be seen bubbling. So here, if there is presence of bubbles in the solution, we will get an idea that there is passage of flatus, whereas if there is no bubbling in the solution, then the passage of flatus is not taking place, and this may be because the tube has not been really inserted into the rectum. And once this tube has been inserted, we must make sure that we can only keep it for a duration of 20 minutes. Here, if the duration is prolonged, then this can affect the ability of the voluntary control of the sphincter muscles. Here, we must make sure that this tube must only be placed for a duration not more than 20 minutes. And if required, or if the distension of the abdomen has not been relieved, then this procedure can be performed every 2 to 3 hours. Now let us discuss about the rectal tube insertion and removal. Here, whether the gastrointestinal hypomotility can be because of the slow passage of fecus or flatus, or which can even result to paralytic ileus. Here, by inserting this rectal tube, it will help to relieve the discomfort caused by the flatus or even the fecus. Not only that, but this decrease in the motility or in the peristalsis can also be caused because of several reasons, such as the medical or surgical treatment, because of certain medications, or even the swallowed air. So here, when this condition is being caused because of these factors, then by passing the rectal tube, this can be resolved. However, if that particular person had just undergone any rectal or prostatic surgery, if he or she has just had any recent myocardial infarction, or even if there is presence of any diseases of the rectal mucosa, then insertion of this rectal tube is contraindicated. So what are the equipments which will be required for this procedure? Here, the first one is the stethoscope. The second is the linen saver pads. The third is the drape. The fourth is the water-soluble lubricant. The fifth is the commercial kit, or even a rectal tube, which is either made up of plastic or rubber, and which is of size between 22 to 34 French. A container, which can either be an emesis basin, a plastic bag, or even a water bottle with vent. Then we also require tape, gloves, as well as the equipment which is needed for performing the perineal care. So before we perform this procedure, we should make sure that we arrange these equipments. Then once this is arranged, we can then implement, or we can then start the procedure. Here, before starting the procedure, we must make sure that we place all these gathered equipments in the patient's bedside. We must also perform hand hygiene in order to prevent cross contamination. We must put on gloves or other personal protective equipments if needed. We must confirm the patient's identity here because it is very important that any procedure that has to be performed must be done for the correct patient. And as a hospital is a very big setting, here there can be presence of two or even three patients with the same name. So in order to prevent confusion while you are confirming their identity, you can ask them about their name and their age, or even any other identifying factors according to the hospital policy. Then once this is done, once you have collected the articles, once you have performed the hand hygiene, and once you have identified the correct patient, the next is you must provide privacy in order to enhance their comfort level, as well as you must explain the procedure in order to reduce the patient's anxiety level. And while you are explaining the procedure, it is also your responsibility to provide an answer to each and every question or queries that the patient might have in order to increase their cooperation, as well as you must also assess or check for the abdominal distension. Here, how can we do this? We can do this with the use of a stethoscope, as well as by using this stethoscope, we will be able to auscultate the bowel sound. So here, this is what we must do. Okay, so once this is done, again what we must do is we must place the patient in a left lateral position. We must lubricate the tube. We must insert the tube. One end must be inserted, the other end must be in the solution, and again this should not be kept in place for a duration more than 20 minutes. So this is about the rectal tube. Now let us move on to the second method, which is enema. Enema is defined as the introduction of fluid into the rectum. This is a procedure which is performed for the evacuation or washing out of waste materials from a person's lower bowel. Here it is in this procedure that we will be able to instill a solution into the rectum, colon, and even into the large intestine. This procedure can be performed using a flexible plastic rectal tube with several large holes in the tip, where one end of the tube will be connected to the tubing from the solution bag or even the container. So what is the action of the enema? Here, what happens is, as we have discussed in the definition, that this is a process through which we can instill a solution into the rectum, colon, and the large intestine. So once this solution is being instilled, there will be a distension in the abdomen, which can lead to irritation of the intestinal mucosa, and because of this irritation it would result in increased peristalsis. So if there is increased peristalsis, then only there will be excretion of fecus or flatus. So here, this is the reason why enema is also administered to the patient who requires a facilitation in the bowel elimination. There are also various uses. The first is by using an enema. By instilling a solution, it will help to soften the fecal matter, which would lead to an easy passage of the fecus. Enema is also used to introduce any medication. It is also performed before several investigation procedures involving the gastrointestinal tract. It is also performed before the conduction of normal delivery. It is performed as a routine preoperative procedure. It is performed as a diagnostic procedure. It is performed to release the gaseous distension of the abdomen. It is also performed in order to reduce the temperature as well as to administer any fluids. So these are the various uses of enema. So here you must understand that enema is not only provided to patient in order to facilitate their bowel elimination, but this enema is also done for various other reasons as well. What is the purpose? The purpose is to relieve fecal matter, is to relieve presence of flatulence or constipation, to prevent involuntary defecation during surgery, to reduce the temperature by providing a cold edema, to check diarrhea, that is by administering the starch opium enema, to stimulate the peristalsis through administering the purgative enema, to make diagnosis, that is by performing or by administering the barium enema, as well as to cleanse the bowel before performing any X-ray studies, to introduce anesthesia, to introduce medications, to destroy the presence of intestinal parasites, to administer fluids and nutrients, to relieve inflammation, and to establish regular bowel function during the bowel training programs. So there are a number of reasons for which this procedure can be performed. However, this is also contraindicated in certain conditions, such as if a person has the history or is having acute myocardial infarction and any cardiac problems. In cases of acute renal failure, appendicitis, as well as any obstetrical and gynecological contraindications. So if a person has the history or is suffering from any of these conditions, then administration of enema is contraindicated. Enema is also classified into two types. The first one is the evacuum enema and the second is the medicated enema. So this evacuum enema is further divided into three. The first one is the simple evacuum enema. The second is the medicated evacuum enema, and the third is the cold enema. So here from the name itself we can understand that this simple evacuum enema is a type of enema in which there will be installation of the solution in order to remove the fecal matter or flatus, whereas in medicated evacuum enema, administration of medication is also possible. And in cold enema, we will be administering this cold edema in order to reduce the temperature of the body. So depending on the condition, as I have told you previously itself, that depending on the condition of the patient, we will be choosing which type of edema is to be administered. Whereas the retained enema is further classified under 5 categories. The first one is the stimulant enema. The second is the sedative enema. The third is the emollient enema. The fourth is the anesthetic enema, and the fifth is the nutrient enema. So here, this stimulant enema is given in cases of shock, poisoning, or even collapse. Here, the solution which will be used can either be the black coffee or the brandy. The second one is the sedative enema. So this enema is being prescribed or is being administered in order to also introduce sedatives into the body of an individual. The emollient enema is a rectal injection of the mineral oil, which is being introduced at a low pressure as well as retained for several hours before expelling in order to soften the stool. The fourth is the anesthetic enema, whereby anesthetic agent will also be administered. And the last one is the nutrient enema, in which nutrients will along be provided in order to improve the nutritional status of a person. So these are the two types of enema, which is the evacuant enema and the retained enema. Now moving on to the methods of providing enema. Here there are 4 methods through which enema can be provided. The first one is the enema can and tube method. So here, when do we adopt this method? We do when a large amount of fluid is to be administered. For example, if a soap and water enema is to be administered or provided, then we will be using the enema tube as well as the can method. The second is the funnel and catheter method. Here, this method is to be used when only a small amount or quantity of fluid is to be administered. For example, the oil enema. The next is the glycerin syringe and catheter method. This is also a method which can be used when only a very small quantity of amount is to be administered. For example, when we need to provide the purgative enema, then this method can be used. And the last is the rectal drip method. This method can be used when the fluid is to be administered very slowly in order to aid in its absorption. So here, if we have to provide a fluid which is to be administered very slowly, which will aid with its absorption, then we can use this method. For example, while providing the nutrient enema, this method is to be adopted. So these are the 4 methods through which enema can be provided. That is the enema, can and tube method, the funnel and catheter method, the glycerin syringe and catheter method, and last is through the rectal drip method. So now here we have come to the end of this topic, whereby in today's session we have discussed regarding the two factors that can facilitate the bowel elimination, which include the insertion of a flatus tube and the enema. Here in enema, we have just discussed about the action, the uses, the purpose, the contraindications about the two types of enema and the four methods through which the enema can be provided. So I will be continuing with this topic in my next session, whereby we will be discussing the procedure for administering enema. So I hope you have got a clear understanding of this topic. I'll be meeting you in my next session. Until then, have a good day. Thank you.